Governor Lamont says they're receiving nearly 50,000 doses of the COVID-19 vaccine per week from the federal government. He does not expect that number to drop, but he does say he needs that number to increase in order to meet Connecticut's current demand for vaccinations. Working with what we have, that's what Governor Lamont says Connecticut has been doing, allocating the state's weekly federal supply of 46,900 vaccines to local hospitals and healthcare facilities.
Could I use 5 times that amount? Absolutely.
States around the country, including Connecticut, feeling the pinch of COVID-19 vaccine shortages. Yale New Haven Health says it could ramp up to 2,000 vaccinations per week, although it's not a matter of capacity, but rather the availability of the vaccine.
Do I hear from hospitals every day, give me more? Absolutely. But that's why we're doing this by appointment. We got this on a schedule. We narrowed the cohort of people who can get it. And if they give us more vaccines, we can speed it up.
One day after being sworn in, President Biden signing 10 executive orders to combat the pandemic.
The goal that was set by the president of getting 100 million people vaccinated in the first 100 days is quite a reasonable goal.
In a news briefing Thursday, the White House's chief medical advisor, Dr. Anthony Fauci, sharing Biden's plans to deploy the Defense Production Act to help vaccine manufacturers such as Pfizer and Moderna increase vaccine amounts. Dr. Fauci adding, as a new variant of the virus emerges in the U.S., it's become even more important to get vaccinated.
Viruses don't mutate unless they replicate. And if you can suppress that by a very good vaccine campaign, then you could actually avoid this deleterious effect that you might get from the mutations.
Back in Connecticut, Lamont says he plans on questioning the federal government on additional ways they are going to accelerate production of the vaccine.
What we can expect in terms of a ramp up. What are the bottlenecks in the supply chain? What can the feds do with their Defense Procurement Act to speed things up? The number one bottleneck is probably the incredibly customized, specialized equipment you need to mix the vaccines, and it's not something you mass produce. Okay, we knew that, but we also knew that 3 months ago. Where are we in that process? That's what we're going to be asking.
So far, Connecticut has administered more than 258,000 doses of the vaccine, and state officials say they are ready to go for when they can begin mass vaccination. At the state capitol in Hartford, Nia Maldonado, Fox 61 News.